Hello everyone. Welcome to another episode of FS-360 PODSESSION. On today's show, we have Dr. Funmi Adewara, founder and CEO of Mobihealth. Dr. Funmi is on a mission to make healthcare more accessible to millions of Africans through technology. I hope you enjoy this very powerful chat about the future of healthcare in Africa. Hi Funmi, how are you today?
I'm good, thank you. How are you? Thank you for inviting me over.
I'm very well, thank you. And congratulations for just winning Sanofi's Africa Tech Challenge. How are you feeling about it?
Oh, I'm very excited. I'm still very excited about it. It gives me more energy to carry on and to continue to do what we're doing. So it's great. Thank you.
Well done, Funmi. So Funmi, growing up in Nigeria exposed you to the challenges that millions of Africans face trying to access basic healthcare. Was this a driving force for you to build Mobihealth? Tell me your personal story.
When I was growing up in Nigeria, as a child, I had my own healthcare challenges that made me go to the hospital. I was a frequent visitor there. I saw patients die needlessly from preventable causes. And when I was ill myself, just by some miracle, I could have become part of the statistics today. And that, that very grim reality is what made me choose to study medicine, because I wanted to help people.
Yeah, thank you for sharing your story. And from a doctor in the NHS in the UK to a tech startup founder, was it hard to take the leap?
It wasn't difficult, because I've always thought that I wanted to make an impact on a global scale. I love clinical medicine, the one-to-one. I miss that interaction, but telemedicine also provides the opportunity for me to be able to make an impact on a global scale.
And tell me more about Mobihealth and how is it making healthcare more accessible to millions of Africans?
So we are Africa's first fully integrated telemedicine platform. Mm-hmm. We enable patients in Africa or anywhere in the world to connect with a doctor anywhere in the world. That's as simple as that. But beyond that, we are a secure platform. So rather than, telemedicine practice has been on for decades. You have well-established companies in the US and some now coming up in the UK as well. So the technology itself is not new. What is new is that digital revolution now provides that avenue for you to be able to scale up and provide this service in a more secure, organized manner. So we provide an end-to-end healthcare solution to the patient. Mm-hmm. And our solution, our business model is built on the principle of making healthcare accessible at a cost-effective rate.
And how Mobihealth is helping Africa fight COVID-19?
So we started off with developing online screening tools. So we're one of the first companies to launch that online screening tool that will help you to assess your risk for COVID. And then we also launched the DIY, so do-it-yourself COVID screening test, the SWAB test. It's still the same gold standard test kit, the PCR test kit that tells you if somebody has a viral infection. Mm-hmm. But we are deploying our platform to expedite testing.
Yeah, wow, Funmi, this is definitely a very powerful story of the great potential of telemedicine and digital health to protect, improve, and save lives in our African continent. This is a very powerful story.
Thank you.
What will be the role of digital health in a post-COVID-19 Africa?
Very good question. We're going to see more tools being developed to enhance the quality of telemedicine consultations, whether it is wearable devices for measuring blood pressure or vital signs, or just for those for physical examination, or even point of care testing tools that are app enabled. Currently on the continent, you have more than 25,000 apps and various tools that are being developed, digital healthcare tools that are being developed, from medication dispensary to drones for drug delivery and blood delivery in Nigeria, in Ghana, and Rwanda. So we're going to see more uptick, an upward trend in digital health, and it has come to stay, and it's very fascinating. This is the right storm that we need to take advantage of.
I would say was some of the most powerful innovations coming from mobile technologies coming from Africa, right? We have a lot of examples like mobile money, solutions around financial inclusion as well. So it's just amazing the amount of great innovation coming out of Africa, right?
And that is despite all the challenges that we have in terms of the poor funding, in terms of the poor infrastructure. You know, Africans are innovating solutions in the most their environment. You know, no light, no water, but they're innovating. So
it's part of our DNA. I like
how
to
much
say
more
that.
if we
I like to say that that's part of our African DNA, right? Entrepreneurship and innovation is part of our DNA. Do you agree with that?
Absolutely, absolutely. I couldn't agree more. We have a young population.
Yeah.
More than 70% of the African population are under the age of 25. So we have young, vibrant, you know, bold people, young people who are willing to take on the storm, yeah, and just create solutions for both the middle class and those at the bottom of the pyramid.
Yeah. So Funmi, I can feel that Mobihealth is part of a bigger vision that you have for the future of healthcare in an African continent. What that future looks like in your head?
We need to empower, you know, we need to innovate, we need to develop solutions, and we need to manufacture this within the continent. We need to invest in healthcare infrastructures, in hospitals. We need to invest in training and remuneration of our doctors so that we can keep them on the continent. So I'm looking forward to an African continent post-COVID that will see this as a perfect storm to build the healthcare system that is self-sustaining and that caters for the health of its citizens. There's no reason why, right, under the planet that we cannot attain universal health coverage.
Definitely.
And this is the point. So I'm looking forward to an African continent that is self-sustaining and that can build the right infrastructure and put policies in place for the adoption of digital health to the very last mile. And yeah, so that's
a powerful vision. And I like to say that we need to join forces to build that Africa together, right? For me, Africa needs you, right? Africa needs me. Not Africa needs all of us. And now it's not tomorrow. Africa needs all of us now, so we can build that future that you just mentioned. And Africa is now, Africa is the future, and we're here to build that. Yeah.
Thank you.
Funmi, thank you very much. This was a very, very interesting and inspiring conversation. Thank you so much.
Thank you. It's my pleasure. Thank you for having me.
Thank you.
And you're doing a very good job. Thank you.
Thank you, Funmi. Thank you.